Have you ever checked your blood pressure in the morning and wondered, why is it high today? I didn't even do anything wrong, for many old. Are adults maintaining healthy blood pressure without? Medication feels almost impossible, like trying to hold water in your hands. But the truth is, small daily habits can make a big difference, and today, we'll explore simple, science-supported steps that may help you keep your blood pressure in a healthy range naturally and safely. This video is not medical advice, but it will give you tools you can bring to your doctor and steps you can begin gently starting today. If you're over 60, your blood vessels naturally become less flexible, almost like an old garden hose that doesn't bend as easily as it used to. That makes it harder for blood to flow smoothly, which can raise pressure inside the arteries. According to major health organizations, nearly 2 out of 3 adults over 60 have elevated or high blood pressure, and many don't even feel symptoms. That's the tricky part. Hypertension is called the silent risk because people often feel fine until something goes wrong. High blood pressure over time may increase the risk of stroke, heart disease, kidney problems, and issues with memory or focus. But here's the encouraging part. Lifestyle habits have a surprisingly strong effect on blood pressure, sometimes stronger than we imagine. Even small improvements in movement, food, sleep, and stress can support healthy blood pressure, and many seniors have successfully lowered their numbers with simple, consistent steps. Let me tell you about Bob Mitchell. Bob is a 72-year-old retired engineer from Ohio. For years, he checked his blood pressure every morning, and every morning the numbers seemed to creep higher. His doctor suggested medication, but Bob wanted to see if lifestyle changes could help first. This is Bob's personal experience and not medical advice. Individual results vary, and you should always consult your healthcare provider before making changes to your health routine. Bob started with small steps: a 5-minute morning walk, swapping his usual bacon breakfast for oatmeal with berries, and drinking more water throughout the day. Within 8 weeks, his systolic pressure dropped by 12 points. His doctor was impressed, and so was Bob. He didn't do anything extreme. He just made consistent, gentle changes that his body responded to. Today, we'll break these steps down into what to avoid, what to do, micro habits you can use immediately, and questions you can bring to your doctor. Many adults assume their pressure is high just because of age, but often certain everyday habits quietly push the numbers upward. Let's go through the most common ones. First, avoid the hidden salt trap. Salt is everywhere, not just in chips or snacks. Bread, sauces, soups, frozen meals, and even healthy foods can contain high sodium. For older adults, sensitivity to salt often increases. It's like your body becomes more reactive to sodium than at Washington's at age 30. Why avoid it? Excess sodium makes your body hold extra fluids, which increases pressure inside the blood vessels. Bob used to love canned tomato soup for lunch. He thought it was healthy until he checked the label and saw nearly 800 milligrams of sodium per serving. That's more than a third of the daily recommended limit just in one bowl of soup. Second, avoid sitting for long stretches without breaks. Sitting for hours can stiffen blood vessels and slow circulation. Even if you walk daily, long uninterrupted sitting can still raise blood pressure temporarily. Think of the body like a car. When it sits unused, the fluids settle. Third, avoid white-knuckle stress. Some seniors stay calm outside but carry quiet tension inside, worrying about finances, health, or family. Stress hormones like cortisol can gently nudge blood pressure upward throughout the day. Bob told me he used to wake up at 3 a.m. mind racing about bills and his grandson's college tuition. That chronic, low-level worrying was like background noise, always there, always affecting his body. Fourth, avoid drinking less water than your bod. Why needs? Dehydration makes the blood thicker. Like syrup instead of water, this forces the heart to pump harder, which may raise blood pressure temporarily. Fifth, avoid too many processed food. Processed foods often contain high sodium, added sugars, low potassium, and low fiber. This combination is tough for blood pressure balance. Sixth, avoid overusing caffeine for sensitive individuals. Not everyone reacts to caffeine the same way, but about 30 to 40% of older adults experience a temporary rise in pressure after coffee or tea. Seventh, avoid poor sleep or inconsistent sleep, short sleep, or non-restorative sleep can disrupt the systems that regulate blood pressure. Even one bad night can temporarily raise numbers. Eighth, avoid silent elevator medications. Some medications, like NSAIDs and decongestants, may elevate blood pressure. This is not medical advice, but it's something you can discuss with your doctor. Now let's focus on what helps. These steps are research-supported, gentle, and can be tailored to your daily routine. We'll go from easiest to more advanced. Starting with Level 1, Easy Daily Habits You Can Start Today. First, practice 5-minute morning movement before breakfast. Spend just 5 minutes lightly moving. Slow marching in place, stretching your arms overhead, gentle side steps. This small routine wakes up your circulatory system and may reduce morning pressure spikes. Bob started doing this while his coffee brewed. 5 minutes, that's it, he said. It felt like waking up his body gently instead of shocking it into the day. Second, use the 1/2 plate fresh rule. At lunch or dinner, aim for half of your plate to be vegetables, salads, fruit, or fresh produce. These foods are naturally high in potassium, which helps balance sodium. Third, drink 1 glass of water before each meal. Hydration helps blood flow more smoothly, like a well-oiled machine. Fourth, try the salt swap method. Instead of removing salt completely, replace it slowly with garlic powder, onion powder, lemon, or herbs like rosemary, basil, and oregano. Taste buds adjust in about 2 to 3 weeks. Bob switched to garlic powder and smoked paprika on his eggs. At first, he missed the salt, but after 2 weeks, he said the flavors actually tasted richer. Fifth, take 3 mini movement breaks. Every hour, stand or walk for 60 seconds. Science shows these micro breaks can help regulate blood pressure throughout the day. Moving to Level 2, Science-Supported Lifestyle Strategies. Sixth, walk 20 to 30 minutes per day. Even slow walking helps. Imagine your arteries as flexible tubes. Walking helps massage them from the inside, improving responsiveness. Seventh, eat potassium-rich foods. Potassium helps the kidneys flush extra sodium. Great examples include bananas, spinach, avocados, sweet potatoes, and white beans. Most seniors don't get enough potassium, but some people with kidney conditions must limit it, so always confirm with your doctor. Eighth, practice box breathing. Inhale for seconds, hold 4. Exhale 4, hold 4. Repeat for 1 minute. This calms the nervous system and may help lower temporary blood pressure spikes. Bob does this before checking his blood pressure. he said it changed everything, not just the numbers, but how he felt about checking them. Ninth, improve sleep quality. Try consistent bedtime, cooler room around 65 to 67 degrees Fahrenheit, avoiding screens before bed, and a warm shower before sleeping. Better sleep helps regulate hormones that influence blood pressure. 10th, add fiber slowly. Fiber helps with weight, balance, heart health, and glycemic control, all connected to blood pressure. Good sources include oats, apples, chia seeds, and vegetables. Now for level 3, advanced but doable H. Of its 11th, follow a heart-friendly eating pattern. You don't need a strict diet. You can follow patterns inspired by the DASH or Mediterranean diets, lots of vegetables, lean protein, nuts, and seeds, moderate whole grains, and limited processed foods. This pattern consistently supports healthy blood pressure in research. 12th, gentle strength training twice per week using light dumbbells or resistance bands helps arteries become more responsive. Try 8 to 10 simple movements like bicep curls, chair stands, and wall push-ups. Bob started with 3-pound dumbbells, just enough to feel his muscles working without straining. Twice a week, nothing fancy. But after a month, he noticed he felt stronger carrying groceries. 13th, track what your body responds. 2. Keep notes for 7 days on foods, beverages, sleep pattern, stress level, and blood pressure reading. You might discover surprising triggers like certain soups, restaurant meals, or late-night snacks. Bob discovered that Chinese takeout always spiked his numbers the next morning, not because of the food itself, but because of the sodium in the sauces. 14th, discuss medications with your doctor. Some older adults take medications that slightly elevate blood pressure. A doctor may be able to adjust timing or dosage. Here are some micro habits for quick wins. 10 deep breaths before checking your blood pressure. Drink water immediately after waking. Add 1 fruit per day. Reduce canned soups. Stretch your chest and shoulders daily. And dinner with ASH. Or 5-minute walk. Use smaller plates too. Avoid overeating. If you found these tips helpful, please like, subscribe, and share this video with a family member or friend over 60. You can also save this video and rewatch the summary chart before your next doctor visit. And remember, none of this replaces medical advice. Always talk with your healthcare provider before making major changes. Many people ask, can I lower my blood pressure naturally without medication? For some people, lifestyle changes may help support healthier levels, but every individual is different, so always work with a doctor. Others wonder, how long does it take to see improvements? Some people notice changes in a few weeks, others need several months of consistent habits. Some ask, is sea salt better than regular salt? Not really, both contain sodium. The key is total sodium intake. Another common question is, what time of day should I check my blood pressure? Morning and evening are common. Take readings at the same time for consistency. People also wonder, can coffee raise blood pressure? It can temporarily raise pressure in some individuals, especially if they're sensitive. Another question is, should I avoid salt completely? Not necessarily. The goal is reducing excessive sodium, not removing it entirely. Finally, why ask, what number should I worry about? Ask your doctor for personalized targets. Ranges differ based on age and health history. Let me share a quick summary to help you remember key points. Things to avoid include hidden salt, In packaged foods, long sitting periods, excess caffeine if you're sensitive, poor sleep, processed foods, and quiet chronic stress. Things too. Don't include 5-minute morning movement. The 1/2 plate fresh method, hydrating consistently, micro walks for 1 minute hourly, potassium-rich foods, breathing exercises, and 30 minutes of walking daily. Quick wins include drinking water before meals, adding 1 extra veggie, taking a short evening walk, and using herbs instead of salt when talky. And to your doctor, you might ask, which medications may affect my blood pressure? Is potassium safe for my kidneys? What should my personal blood pressure target be? The information in this video comes from trusted sources. Harvard Health Publishing discusses how sodium reduction, physical activity, and weight balance can help support healthy blood pressure levels. Mayo Clinic provides insights into lifestyle-related blood pressure influences and the benefits of regular exercise. The National Institutes of Health summarizes how potassium-rich foods, reduced sodium, and balanced nutrition can support blood pressure health. The American Heart Association clarifies blood pressure categories and factors that may influence the cardiovascular system with age, and the CDC discusses prevalence, risks, and prevention strategies for older adults. This video is for educational purposes only and is not medical advice. Always consult your doctor or licensed healthcare professional before making any changes to your diet, exercise routine, supplements, or medications. The personal story shared in this video reflects one individual's experience and is not a guarantee of results. Everyone's health situation is different, and what works for one person may not work for another.